So for the final topic in breast augmentation, we are going to discuss the complications because there are a lot of terminologies that have been described for the same. So the first most common one is the infection in the implant, which is mainly by the staph epidermidis from the skin surface and from the nipple areola region, because of which a tape is placed over the NAC region to avoid any sort of contamination. Further, a triple antibiotic solution consisting of bacitracin, gentamicin and cefazolin is used to wash the implant before insertion. A glove change is mandatory and a no-touch technique is used wherein the implant should not touch the skin before the insertion. So that can also be done with the help of a Keller's funnel. Rupture of the implant has known to occur, which can be seen in the MRI. Usually an MRI after the 3 years is recommended to make sure that the implant is in proper condition, and thereafter every 5 years a checkup with the MRI is recommended. In case of the rupture of an implant, the leak of the silicone is seen in the MRI film and it is known as the Linguini sign. So it appears in a semi-curved form like the shape of a linguine pasta. That's where it gets its name from, and that is known as the Linguini sign. A common and popular one is the contracture that occurs in the breast tissue, which is been described by Baker's, and the Baker's classification ranging from grade 1 to 4 has been described for the breast contracture that occurs because of the implant. So it's the contracture of the capsule which is surrounding the implant. Then is the double bubble deformity, as we have seen in the previous video as well. So when the IMF is not secured and the implant moves downward, you can see the breast and the implant as two separate entities, which is known as the double bubble deformity or the sign. Then is the rippling or the visibility. So if the upper pole thickness is not sufficient, the patient has very thin skin and the implant is placed in the pre-pectoral position, that is the subfascial position, then a visibility of the implant is seen, which is known as the rippling effect. Then is the Snoopy nose or the waterfall deformity. So if the breast tissue glides or slides down over the implant, if it is not of a proper size or it is moving around too much on its pocket, then that deformity is known as a Snoopy nose or a waterfall deformity. One of the most dreaded complications, but fortunately not very common complications, is the BIA ALCL, that is the carcinoma which has been documented with the breast implant, which is the breast implant associated anaplastic large cell lymphoma. This incidence has been higher with the texture type of implants, whereas the contracture has been seen more in the smooth surfaced implants. A recently described one which has become very popular is the BII, which is the breast implant illness. So this can have a wide range of symptoms, starting from any form of body ache, dry eyes, foggy brain, depression, hair loss, rashes, gastrointestinal symptoms. So they somehow appear to be like an autoimmune sort of dysfunctioning, but the usual markers for autoimmune and the investigations prove negative, but it has been known to occur few months or years after the breast implant, and strangely enough, after the removal of the implant, the patient gets relief from most of the symptoms. So that is known as the breast implant illness. The exact cause is yet to be determined. Finally, we have the BAD, which is the breast animation deformity. So what happens when the implant is placed below the pectoralis major muscle, that is in the subpectoral or submuscular position? When the patient, it can also happen sometimes in a dual plane. So when the patient contracts the muscle, that is the pectoralis muscle, the implant moves up in position, which becomes very evident, and that is known as a breast animation deformity. So these were all the complications associated with breast implants, and in the next series we will see on breast reduction.